I'm Alicia Menendez. I will see you here tomorrow, 6 p.m. Eastern, for more American Voices. For now, I hand it over to my friend, Dr. Jason Johnson. Hey, Jason.
Hi, Alicia. Thank you so much. I am ready to go. Hey there. I am Jason Johnson in for Joshua Johnson. The United States continues to break daily records in the pandemic, but tonight there's light at the end of the tunnel. Welcome to the week. The United States surpassed 16 million coronavirus cases this afternoon, while breaking daily records for cases, hospitalizations, and deaths. Right now, 1/3 of hospitals across the U.S. say that at least 80% of their ICU beds are occupied. But last night, the FDA authorized Pfizer's coronavirus vaccine for emergency use. The first doses are expected to arrive in hospitals across the country by Monday. I'll talk with a former FDA commissioner about how it'll all work and what challenges we will face next. Plus, Congresswoman Maxine Waters tells us where things stand with a coronavirus relief bill. Will Congress break for the holidays without offering a lifeline to millions of Americans? We begin tonight with a sign of hope as we near 300,000 coronavirus deaths in the United States. And for context, only 291,000 people died in World War II. Help is on the way. An estimated 2.9 million doses of Pfizer's coronavirus vaccine will be distributed across the United States this week. Vials of the vaccine will be packed into sub-zero containers and loaded onto trucks at Pfizer's manufacturing facility in Portage, Michigan, starting tomorrow morning. And that's where we find NBC News' Ellison Barber. Good to speak to you, Ellison. How are you?
Hey, Jason, we expect to start seeing those vaccine shipments leave this Pfizer plant in Portage, Michigan tomorrow morning. Then the shipments will start to make their way to distribution centers in Memphis, Tennessee, and Louisville, Kentucky. One of the big challenges for Pfizer is making sure that this vaccine stays really cold. We know this vaccine needs to be kept at negative 94 degrees Fahrenheit. So what does that mean? It means that they're going to use a whole lot of dry ice and also put devices inside of the packages so that someone can monitor the temperature as these vaccines start to make their way to all of the different states and U.S. territories. We know that the U.S., they allocated the first 6.4 million doses of this Pfizer vaccine to states and territories based on the size of their adult population. But all of that is not going to go out immediately. As you said, we expect about 2.9 million doses of the Pfizer vaccine to go out initially. Pfizer is holding back about half of the vaccines available because this vaccine, in order to be effective and really inoculate people from the virus, you need to have 2 doses. So they're going to send out the first about half of the vaccines in that initial big allocation to get people vaccinated initially, and then they're going to hold back another 2.9 million to send that out 3 weeks later so people can then get that second vaccination. So this is going to be a long process. Obviously, we know that it's going to take a very, very long time for us to have the amount of COVID vaccines for most people who need it. But we do expect to start seeing the vaccines make their way from Michigan tomorrow morning. There will be some that will also leave another Pfizer plant in Wisconsin. The head, the Army general who oversees Operation Warp Speed, he says that there will be vaccines at 145 sites across all 50 states by Monday. More will go out on Tuesday, more on Wednesday. They say by Wednesday they expect to have all of the initial 2.9 million doses shipped out to different states. Each state then has its own distribution plan to get these doses to hospitals, pharmacies, local health departments, so that we can see healthcare workers and people living in long-term care facilities start to get vaccinated. Jason?
That is fantastic news. NBC's Ellison Barber, thank you so very much. Once this initial rollout of vaccines is complete, the country and the world still have a long way to go. Each state will have to decide who gets vaccinated next and when. And it's important to note this rollout alone isn't enough to end the pandemic. The former acting director of the CDC, Dr. Richard Besser, told NBC News in a statement, quote, "The potential of this moment to change the course of the pandemic will only be realized if it's accompanied by thoughtful action. Individuals must continue to follow proven healthcare guidance like wearing masks, maintaining social distance, and washing their hands. Joining me now to talk about what comes next in the fight against the coronavirus pandemic is a former FDA Commissioner, Margaret Hamburg. Thank you so very much, former Commissioner, for being here. So I'll start with this. This is good news, right? We should see this as the beginning of the end, or is this just the beginning of the battle against the coronavirus pandemic in America?
Well, this is extraordinary news. We have a vaccine that is very effective and very safe from all of the study that's been done so far. It's been developed more quickly than any vaccine in history, but with strong science driving the process, no corners being cut in terms of how the development process has gone forward. And we need this vaccine. A vaccine can give us the vital public health tools for managing and ultimately controlling this devastating global COVID-19 pandemic. But it's going to take time. We have to be patient. The vaccine isn't available in the quantities we'd like, so it's going to go to priority groups first, as we've just been hearing about. It's going to take 2 doses for everyone, so that takes time also. And we don't fully know whether the vaccine totally prevents infection and possible transmission. So all during this time, we're going to have to still be doing those critical public health measures of wearing masks, social distancing, avoiding large gatherings, especially outside, hand washing, and being very, very mindful that the virus is with us for a while.
So Margaret, you just said something interesting. You said we're not entirely sure that it prevents infection and transmission. Then what do we think the vaccine is going to do? I would think that that's sort of the bare minimum. What is this first version of vaccine going to do?
Well, this has been a surprise to a lot of people to hear. We know that the vaccine prevents serious disease. It reduces hospitalization and the length of disease, but it may still cause some asymptomatic infection, and asymptomatic infection where someone can spread it. So more studies are going to be done to understand that. You know, there are other vaccines where this is the case. Flu vaccine, you may have gotten flu vaccine in the past, but still, you know, gotten some illness from it, and we can still see spread. So there's still information we need to learn, and we still have to undertake all of those public health measures to control spread, reduce risk to ourselves and to others.
So as this is being made available, and we have just a couple minutes here, as this is being made available, do you think you will run into resistance, right? Because you have some initial, frontline healthcare workers, they may want this. But what if a police union says no? Or what if EMTs say, I don't want this? Or what if firemen say, I don't want this? Just because we have the first dose being delivered on Monday, do you anticipate running into any resistance even from frontline workers who may not want it?
Well, we know that there is resistance to vaccination in some quarters. There has been for a while with the anti-vax movement. And then with this particular vaccine, we've seen an increase in what we call vaccine hesitancy, because people have been concerned, has it gone so quickly that corners might have been cut? And also there have been some politics involved, pressure from high-ranking public officials, and people have wondered, can we trust this vaccine? Encouragingly, we're seeing the numbers of people reporting that they would like to take the vaccine going up, I think in large part because the process has been very transparent. People see that the science is there and see that these vaccines look like they're really going to work and are quite safe. But we have to help make information available to all of the public. We need to make sure that people are hearing about the vaccine, why it matters, how it's going to be given out, and hearing about the vaccine from people that they trust in their community, not just public officials making pronouncements from their doctors, from their faith leaders, from community leaders and others. So there is work to be done. And we know in particular that communities of color who are at higher risk for disease from COVID are particularly skeptical about the vaccine because of past experiences and distrust with the healthcare system and biomedical research. So we really need to make sure that we're working with all communities about the importance of the vaccine and making it available to them.
I like this term you use, vaccine hesitancy, right? We have anti-vaxxers, vaccine hesitancy. Hopefully after this, people will be more, say, vax curious. Margaret Hamburg, right, former commissioner of the FDA, thank you so much for your time.
Thank you.
Tomorrow night on The Week, we will be asking a doctor your questions about the coronavirus and the vaccine. Send your questions to us, email theweek@msnbc.com, or tweet at theweekmsnbc. They might be featured on the show. Earlier this week, it looked like a deal on coronavirus relief might be on the horizon. A group of bipartisan lawmakers proposed a $908 billion plan. But tonight, it seems like we're right back to where we started. Senate Majority Leader Mitch McConnell now saying he sees no possible path to an agreement on two contentious issues: state and local government funding and liability protections. And with the holiday recess right around the corner, pressure is on for the two sides to come together and help millions of Americans. There's a lot at stake here. Just look at all the programs set to expire if Congress fails to take action. Joining us now is Congresswoman Maxine Waters from California. Congresswoman, thank you so much for joining me this evening. I'm just going to start right off. What can the Democrats do? Because I would think it's unfair to say, can the two sides come together? The House has a plan. The House has had a plan for a long time. What pressure do you think can be put on Mitch McConnell so that anything can move through the Senate before hundreds of thousands of Americans are put out on the street and lose their benefits at the end of the year?
Well, a lot of pressure has been attempted thus far, and nothing has changed this man. And it's absolutely unconscionable that one human being can literally stop the kind of support that we need to be given to our public relative to COVID-19. He is absolutely blocking everything. You have a bipartisan group of senators who have come together. You have others that are trying so very hard. You have the Democrats who have basically compromised substantially from where we started with $3.4 trillion down to $2.2 trillion. And now Nancy Pelosi and Schumer have stepped back, and they are supporting the Problem Solvers Caucus, trying to work with the bipartisan caucus of the Senate. But McConnell is blocking everything. He has stepped in, and he is absolutely convinced that he's not going to cooperate, particularly as it relates to liability. And of course, now he's added back again the cities and the states, where everybody has agreed that the cities and the states should be, really given great consideration in funding because of all of the frontline workers that we have. And so it's McConnell. And you ask me, can we put pressure on him? He is acting out publicly. So everybody sees that he's an obstacle, that he's not going to give in. So we've done everything that we can do. Everybody continues, but he's right there blocking everything.
Congresswoman Waters, this is a key thing, and I want the public to really understand what it is that Mitch McConnell is trying to do here. What is the liability argument right now? What is he trying to make sure is not a part of this bill that will ultimately harm American people? But I think people need to hear it from you. What exactly is this sort of liability part of the sort of care package being put together?
Well, I think basically what he has focused on is trying to protect the major corporations by saying if people who work for them are made to work, despite the fact they have symptoms, despite the fact that, they have indicated that they feel that they should not be there, they need to be tested, et cetera, et cetera. What he's doing is protecting these companies from any liability based on the fact that these people could, die. They could get ill, they could die, and many of them, and particularly, we found this was true in the meatpacking industry. Many of them were told, if you don't come to work, you're fired. And these were single, parents in some instances who, needed that money, even though they were very low wages oftentimes, but they had children, they had nowhere to turn. And so there were many who continued to come to work, even though they were sick.
So
and that's
just
basically what this liability question is all about.
So basically what Mitch McConnell is arguing for is the right for you to go to work, possibly get COVID, get sick, and die, and your company gets away with it. Maxine, Congresswoman Waters, this is the other thing that I think I really want people to sort of understand going forward. We have all of these crazy lawsuits that have been happening with, Donald Trump and trying to knock out the election and trying to say that Joe Biden wasn't legitimately elected. But the real concern that I have, and a lot of people have, is that you have over 126 members of Congress on the House side who joined in this ridiculous lawsuit. What do you think, as a sitting member of Congress who will be going back for the next Congress next year, what do you think, if anything, should happen to these members who joined in these ridiculous lawsuits? Do you think that Leader Pelosi should do something about it? Do you think they should be censured or reprimanded? Or do you think that's just the new reality we're going to have to deal with in sort of a post-Trumpist American Congress?
Well, some of our members are advocating for not seating them at all. And I suspect that may not happen. And I think the attitude is we've got to keep moving. We've got to move forward. And so when we talk about, certain things that could be done, investigations, not seating, in some way penalizing, I think there's not a lot of support for that. But we're going to have to see how strong members are going to be, particularly on our side of the aisle, because we are so disgusted. We are so absolutely outraged that 126 members of Congress don't have any guts that they would dare sign on to an amicus brief that comes out of Texas, even though they know in some of their states that Biden absolutely won those states. And we just can't believe that they're this weak. We can't believe that they would follow the president in this way. We can't believe that they would defy the Constitution. But the Supreme Court put them in their place. The Supreme Court said, don't bring this mess to us. As a matter of fact, you can't even file it, let alone get us to the point where we would hear it. And so that gives you some hope because we know that the president thinks that he could intimidate the United States Supreme Court because now, the more conservative members are in the majority, and he believes because he has, reined in on the Supreme Court, and he thinks he owns it, but they showed him, you don't own it, and I'm pleased about that. I'm so pleased.
Congresswoman Waters, I can't let you go without asking a question I know you know is coming. Do you have any thoughts about what the governor of California should do to replace Senator Harris once she becomes vice president? Do you have any thoughts as to who he should select, or do you think you just trust him?
You're absolutely right. I don't know who he's looking at. I do know that there are any number of women who have been identified as possibles. And we have people that are advocating for different ones. And so, no, we don't know. And I don't know what Governor Newsom is going to do. But he has a decision that he has to make. And I think that it will be a Black woman. I think he understands that, when Kamala Harris leaves, the Senate, that's only one Black woman who was serving. And certainly it would be, kind of, unfair not to have at least another Black woman replace her. So I think that there's a lot of pressure on him to replace her with a Black woman. That's all I can tell you. That's all I know.
Oh, that's what we wanted to hear. That's what we wanted to hear. Congresswoman Maxine Waters of California, thank you so very much for joining us this evening.
You're so welcome, and thank you.
Still to come, the vaccine is about to roll out. New numbers show only half of Americans are willing to get it. Will that be enough to make a difference? Plus, the Supreme Court rejected a bid from the state of Texas asking justices to invalidate millions of ballots cast in the battleground states. So what, if anything, does the Trump White House have left? And 126 of 196 House Republicans supported the effort. Will they accept the outcome? Will they follow the president's lead? All of that's coming up this hour. Stay with us.